Hello everyone. Uh, Good afternoon, and thank you for joining me on the session on prevent, treat, and defeat sepsis. So this is one of the most burning topics in medical field because, as you all know, I would be going through the significance of sepsis. However, as most of you already know, sepsis is a dysregulated host response to any infection. So, if our body gets infected, so our body shows a response that is called sepsis. So, why is it so important, and how are we going to treat it? How are we going to identify it? Then, how are we going to prevent it? These are the aspects that we are going to discuss today. And before we start, let me introduce myself again. I'm Dr. Chandra Sekhar. I'm a senior consultant critical care at KIMS-Saveera Hospital, Anantapur. So, as I've told you, by definition, so it might be useful to some of the doctors who have joined. So, sepsis by definition is a life-threatening organ dysfunction which is caused by dysregulated host response to infection. So, any infection that attacks our body, so our body shows a set of responses which are usually inflammatory, dysregulated responses. So, these responses can adversely affect our body. Starting with simple symptoms to severe shocks. So there were definitions which have evolved from 1996 so till date. So the latest sepsis guidelines were formed in October 2021. So they have categorized it into two categories. One is the sepsis and the other one is the septic shock. Septic shock basically is sepsis with multi-organ dysfunction. So the patient tends to have organ dysfunctions developed along with circulatory, cellular, and metabolic abnormalities. So this is for completion of the definition. But what we want to know today is why is it important and what are the common public, how are they going to identify it, and how are they going to treat it, and then how are they going to prevent it. So when you just have a glance at sepsis, so sepsis is the third leading cause of death all over the world. So first being the heart diseases, then being the cancer, and third being the sepsis. That is how important it is to the medical field and how important it is to the general public to notice it early and to attend it at the earliest. So why is septic shock, as I've told, the severe entity of sepsis, can drop your chances of survival by 7.6% each hour. So every hour we delay the administration of antibiotic once the patient is in the hospital, or every hour we delay in identifying the sepsis. So there is 7.6% chance of survival. So what is the incidence of sepsis? So like I've told, it is the third leading cause of death all over the world. So if you take the incidence, this was published in 2020 on the World Sepsis Day. That is the September 13th on World Sepsis Day, this was published. So the data then showed almost around 5 crore people all over the world suffer with sepsis every year. So in that there are about 1.1 crore people who die. So that is almost equated to one death every 2.8 seconds. So which is very, very alarming, and this is something to be noted. And then even if the patients come out of this very severe sepsis and the septic shock, most of the times they tend to have post effects of the sepsis, like they tend to have long-term fatigue, long-term concentration disturbances, and long-term complications associated with it. So this is very important in terms of taking care. So what are the common sources of sepsis? So we talk so much about sepsis. So sepsis can be from any source, starting from our head to toe. It can be a simple skin infection, or it can be an uncontrolled diabetes with a small hair follicle infection, or it can be infections of the lung, infections of the brain, infections of the spinal fluid, infections of the urine, and infections of the catheter related. Some of the patients who are old and elderly who have a catheter in situ, like Foley's catheter or any other catheters placed like the Riles tube, they can have infection through the particular source. And other common infections that account for almost 50% of the sepsis are the abdominal infections, like the simple, starting with the simple gastroenteritis to complicated pancreatic infections and complicated large bowel infections. So all these infections uh, can degrade us in many different ways. So what are the other sources of sepsis? Sometimes when you see all these sources and you rule out, there might be an undifferentiated sources like the blood infections or the sepsis of undifferentiated origin. So in these two cases, we won't be able to exactly identify what is the source. Unlike the other ones, like say a clear-cut respiratory pneumonias, where you tend to know that okay, I have cough from a few days, or I have breathlessness on from a few days, then probably the source might be pointed to the lung. Whereas in some cases, like the bloodstream infections or sepsis of undifferentiated source, it is very, very difficult to identify. But for the common public perspective, we would like to know the common symptoms and the common features of sepsis so that we can immediately identify and bring them to medical attention at the earliest. So, what are the common features of sepsis? These are some of the important features that are highlighted here. There are many more features that needs to be kept in mind. But for the general public knowledge, it's important that we know simple things like the patient tends to have fever, usually low grade, and some may even have high grade fevers, and it is associated with fast heart rate. So you can just check the pulse rate of the patient. So usually when we check it in our radial pulse. So whenever we see the hand with the radial pulse, we'll be able to identify that it's beating very fast. So something beyond 100. So it is important. So it definitely corresponds to the heart rate of the patient. And low blood pressure. Usually when you touch their pulse, the radial pulse, you also feel that it is of low volume. So, or if most of us nowadays have a fully automated blood pressure monitoring at home machines. So you can use the machine and check your blood pressure. Most of the times, these patients will have low blood pressure. And sometimes, instead of high temperatures, they can have lower temperatures also. So what is the normal body temperature? The normal body temperature is around 37 degrees Fahrenheit. So something lesser than that or something beyond 38 degrees Fahrenheit, they can have that. And shaking or chills along with myalgias. Myalgias is having generalized body pains, then easy fatigability. So they tend to get fatigued easily. And sometimes in severe cases, they can have confusion or disorientation along with shortness of breath, means they tend to be breathless, they tend to be breathing very rapidly, and they tend to have a increased respiratory rate along with shallow depth. So they tend to just breathe very fast all the time, and they complain of a sense of extreme discomfort. So instead to make it more easier for common public to understand, the Surviving Sepsis campaign or the Global Sepsis Alliance has created this mnemonic which exactly corresponds to the term sepsis. So S stands for slurred speech, and E stands for extreme shivering, and the P stands for passing no urine over the last 24 hours. And then S again corresponds to severe breathlessness. I, if the patient feels doomed or he feels he's going to fall off. And the last one, S usually corresponds to the features of the skin, like the skin mottling or warm, clammy extremities. So this is a mnemonic created. There are several other mnemonics like the time, which suggest how important it is to get the patient and identify them at the earliest. So before we know how to prevent it and how to attend it, we have to know the people at risk, that too, compared to the general population. So most of the times it's very well known to most of us. So we always consider very small toddlers to elderly age group patients to be the most at-risk patients, and then mostly pregnant mothers are at high risk, along with people with uncontrolled diabetes and people with chronic illnesses like chronic diabetes, chronic hypertension, and also we have to consider people with immunodeficiency like having HIV or any other immunodeficiencies, or patients with autoimmune diseases. So these are the patient categories who needs to be especially careful, and especially if somebody is diabetic, and they need to have a regular follow-up so that their sugars are under control, because people with diabetes or people with any other autoimmune diseases, usually they tend to have a completely dysregulated hormonal balance over the body. So it is very important that anybody with diabetes who will have very poor healing, especially of the superficial wounds that happen in the body or any other infections. So it's important that they identify themselves as high risk, or their kith and kin should be always aware that they are at high risk, and it's important for them to follow up their diabetic status. Or other categories include patients like the rheumatoid arthritis, which are on increase now, or patients who are on steroids for chronic pain syndromes. So all these patients come under the high risk group. So it is very, very important that they maintain uh, adequate uh, precautionary measures wherever they are, and it's important that they identify themselves very early, especially in diseased conditions. So, how do we as doctors approach this sepsis? So, as doctors, we always categorize the sepsis, like I've told you, the international definitions of the surviving sepsis campaigns. They define sepsis in two categories now. One is the sepsis, and the other one is the septic shock. So, sepsis basically is treated initially the moment the patient comes. We categorize them as sepsis or the septic shock, and then we start our treatment. So for it may range from a simple sepsis which can be treated in the ward or on an OPD basis to severe septic shock. So the basic line of treatment is similar in both of them. So we start with IV fluids, IV antibiotics. We target for the source control, whatever is the source. Suppose if there are skin and subcutaneous infections, we try to get those infections under control, and if a surgical intervention is needed, we will try to do the surgical intervention at the earliest, and adequate analgesics, that is the pain control medication, along with steroids whenever it is necessary. The patient may require steroid along with blood glucose control and other of his chronic issues. Suppose the patient is having a previous history of stroke and he is on any antiplatelets or any other medication like blood thinners, or medications like his regular vitamin supplementation. So all those medications will be studied through and taken care of. So the international societies of critical care together have formed this 1 hour one bundle. So when the patients come to us in septic shock, we follow this hour one bundle of the surviving sepsis campaign. This surviving sepsis campaign is usually updated every second yearly or every fourth yearly based on the randomized controlled trials done all over the world. So more than 30 societies all over the world participate in forming these guidelines. So we as doctors, especially belonging to the critical care, so most of the times we identify the patients who fall in this category, and we form a complete sepsis team and deal with these patients with an integrated approach, where we like the basic protocols are the same. Start with the IV antibiotics, then IV fluids, then maintaining his blood pressures and the hemodynamics. So our one bundle is very helpful, especially the septic shock patients. We tend to follow a standardized protocol that lets us not miss any important events, especially with regards to patient care, because these are patients who are very, very sensitive, and it's only a matter of minutes before we actually start losing them in case we do not go ahead with the appropriate treatment. So there are complete standard guidelines, like the one you see here. We see the lactate levels. After that, we see the blood cultures, and then we administer broad spectrum antibiotics, then IV fluid resuscitation, and then vasopressors. Vasopressors are nothing but PP support. So when you see this chart or the picture over here, for every point that is mentioned over here, there's a complete appendage which says what should be done at what time. Including, suppose, say, like administer broad spectrum antibiotics. There are antibiotic categories of which antibiotics to be chosen, especially when the patient is in one particular condition, say respiratory. There are particular antibiotics for that. Skin and soft tissue infections, there are particular antibiotics mentioned for that. So all this is done after a thorough research. So patients in septic shock, they are the most delicate patients, and the amount of time that they give to us is also less than 48 hours. So it's almost like we have to be on our toes to make these patients recover. So what are the long-term implications that we usually get in these patients of septic shock? So most of the patients of septic shock, after recovery, it takes a very long time for them to get back to their work. And most of the times, these patients of septic shock usually require hospital administration ranging from somewhere between 7 to 10 days. And once they are back, there will be a lot of fatigue. They might be losing a lot of body muscle. They might be losing their sleep cycle might be completely altered, especially being in an ICU atmosphere. They might be at fear that they might get reinfected again. So everything that tends to cause a lot of mental havoc happens here, starting from the sleep disturbances to the weakness. They may not be able to perform their regular activities as they previously were. So all this causes a kind of mental trauma. And it is very, very important, especially after we discharge these patients, we ask them to come for a follow-up on a frequent basis, maybe once after the first week, and then once after 15 days after that. And we tend to speak to them saying that and reassure that these symptoms are common, and it is important that they get back to their normal as early as possible. And we also suggest them on the dietary tips, probably the need for high protein diets, and the need for better sleep, and how to motivate them. We also discuss it with the family members on how to motivate them. In fact, the recent surviving sepsis guidelines also are very much helpful in terms that out of the 103 new amendments that were made, almost 30 to 40 amendments are based on the quality of patient care. So they have emphasized on how a doctor should completely enlighten the patients about their condition, how a doctor should counsel them, how a doctor should take a written consent for doing all the procedures. And there are options like including terminal care, like suppose the patient is not at all recovering, and the family is burdened financially, or the family is burdened emotionally. So how do we deal with them? There is a complete set of amendments that were made in 2021 surviving sepsis campaign. So after seeing all this, so it's very important that we understand that it's always prevention is better than cure. So before we actually jump into identifying and treating sepsis, it's always important that we prevent sepsis. So what is the most important thing? Hygiene. The hygiene is the only word that stands to prevent sepsis. So personal hygiene, starting from our hand hygiene to what we eat, what we drink, and what are the vaccinations that are advised by the government. The government every yearly formulates the standard vaccinations that are required, and the Center for Disease Control also takes these infectious conditions into their discussions every time, and they tend to formulate newer guidelines. So apart from this, certain important things like safe childbirth, and then preventing hospital acquired infections, This is especially important for the medical fraternity. And apart from that, as general patients, like I have told previously, if somebody is diabetic or somebody has chronic illnesses, it is very important that they maintain their personal hygiene as well as maintaining their medication chart properly, maintaining their regular insulin levels and regular sugar levels under control. And for hypertensive patients, it's important that they maintain their hypertensive control. And most importantly, what we eat. So it's important that we maintain good nutritious food so that we keep our body healthy and prevent ourselves from the infections. So in a nutshell, as I have told, prevention is better than cure. So prevent infections, practice good hygiene, know the symptoms, like the simple ones I have told. You can remember the mnemonic sepsis, and act fast, because sepsis is a medical emergency and time definitely matters. So this is the logo of the Indian Society of Critical Care Medicine, which is working actively from our country for preventing, treating, and defeating sepsis. Thank you all, and I hope you all join us in defeating sepsis. So we will definitely win this battle. Thank you.